All right, everybody, welcome back. We left off chatting about toothbrushes and how manual and automatic toothbrushes have different size and different content of their bristles. The bristles can be naturally occurring or made of nylon. And remember, nylon is the preferred type of bristle because they can be rounded and polished at the laboratory where they're created, which makes the toothbrushes safer and not as effective at removing tooth structure and soft tissue. Remember that there is no ideal toothbrush for everyone. Everyone should have their own little ability to say, this is my favorite toothbrush. In general, when you are recommending toothbrushes to your patients, recommend the soft bristled brushes because they are more gentle on soft tissue and they are more gentle to expose cementum and dentin. If a patient prefers a firmer brush, tell them that they need to replace their brush more frequently but stick to the soft bristled type. They do adapt to the contours of the tooth better with the soft bristles than what a hard brush bristle would do. Toothbrushes should be replaced as soon as bristles show signs of wear, which can be anywhere between 8 and 12 weeks, especially if those patients prefer the firmer bristles. Sometimes patients are recommended to discard their toothbrushes after illnesses. If a person has a stomach bug, they can throw them in the dishwasher, but I prefer to just toss those toothbrushes if a patient is sick and we can get a new one. Automatic toothbrushes are gaining popularity. There is note of improper brushing techniques can cause gingival recession and tissue injury that you kind of saw in that image that was in the second part of this lecture. There is no standard of grading for toothbrushes. All we have for toothbrush gradation is soft, medium, and hard bristles. And again, the soft are pretty firm and the hard are really hard. So make sure that you're recommending the soft bristle brushes to your patients. We can get our cervical abrasion from the frequency and technique of brushing, as well as using excessively stiff bristles, and the abrasiveness of the dentifrice applied can all contribute to the abrasion of the soft tissue and the cervical tooth structure. In summary, abrasive agents are used to contour, finish, and polish the surfaces of restorations and of tooth structure. Remember that abrasives are not only used to smooth crowns, bridges, and dentures, but the abrasives are also used to give you that really smooth feeling of your teeth when you brush your teeth and after you have a coronal polish at the dental office. If you have any questions, please make sure you contact me. You can call, email, or text, and I will do my very best to answer your questions. Again, make sure that you are reading your dental materials textbook, going along with the outline in your module, and going off of this lecture and watching the videos. Thank you for attending this lecture, and we'll see you next time.